From Kansas.
Madam President, thank you. I have filed an amendment number 233 that I'd like to visit with my colleagues about this evening. I'm pleased that we're debating a budget. Budgets have great purposes in individual and businesses' lives, and they're certainly important to us as we try to solve the country's fiscal problems. A budget is a document that determines how much money we have to spend and how we're going to spend it. And in determining how we're going to spend money, we establish priorities. And I want to talk about one of my priorities for the investment of our taxpayer dollars. Kansans and citizens from across the country pay their taxes, and in many ways they would be pleased by those having to pay taxes if they knew that the money was being well spent. And one of the areas that I strongly believe that we can prioritize and that money can be well spent is in support of the National Institute for Health. We have a tremendous opportunity in this country to continue to lead in the world's research to solve individuals' problems with their health, with the treatment of disease, in eradicating disease and treating the consequences of the people of our country and really the people of our world. This amendment that I'm going to discuss and adds $1.4 billion in spending for the National Institute of Health. And our citizens in our country face a significant challenge. There's not a family in our nation has not suffered from the consequences of cancer and other horrendous diseases. And we've seen tremendous success. America leads the world in finding cures and treatments for those diseases. A problem is that the funding for NIH has remained at a virtual standstill since 2010. And in my view, those who come to Congress with the desire to make sure that every dime, every nickel is wisely spent, and those who come to the Congress with the belief that we need to care for people and provide compassion to all, can come together and jointly agree that money spent on the National Institute of Health is both that. It's a sense of providing well-being, comfort, care, and treatment for people who desperately need that. And it's the realization that when we invest in research, in projects that ultimately cure a disease, that we are saving money. We save money by curing and treating diseases, which then means that the cost of health care is reduced. Long before Congress passed a so-called health care reform bill, I outlined to my constituents in Kansas what we could do to save health care costs. And one of the points in my plan was to invest in medical research, because money invested today in research saves lives and reduces costs. There's also the reality that the United States of America is the place to do research, but we're facing tremendous challenges because of the flat line of NIH spending and the lack of real dollars available for medical research. And in fact, we have to worry that there is a brain drain once again going on in the United States. Other countries are investing. Other countries with more difficult economic challenges than ours are increasing their funding for medical research. And I've always worried that if we don't compete, if we don't maintain a steady opportunity for research scientists in the United States, that we will lose the edge and the economic and health benefits that come from having that edge in a global economy. Our own director of the NIH, Francis Collins, highly regarded and with tremendous background, intellect, has indicated that we're seeing the potential for a brain drain. And he says this is what he said in February of this year, just last month. Since 2003, the NIH budget has basically lost about 20% of its purchasing power by effectively flat budgets that have been eroded by inflation. The consequence of that is to guarantee to send us the best and brightest in hopes of being supported is that their chances of being funded has dropped from about 1 in 3, which it has been at that point for the last 50 years, now to 1 in 6. Imagine yourself as a young investigator, a scientist, with a great idea, ready to tackle it, and to do so in your university setting somewhere in the United States, knowing that you only have a 1 in 6 chance of getting funded. Seeing that there seems to be no greater clear path forward achieving stability and support of biomedical research, wondering whether you can legitimately speak to young people who are wanting to follow your path about whether this path is one they should choose. Dr. Collins says, "This deeply worries me." So at a time in which we know we need to encourage our children to pursue degrees and education in science and research and medicine, in the absence of continued increase in funding for health research, for biomedical research, we clearly send a message that this may not be the career you want to pursue, and at the same time, as other countries increase their support for biomedical research, we send a message that maybe, even though you decide you want to pursue this career, maybe you should pursue it someplace else. This is a serious problem that desperately needs our attention. And so I'm going to ask my colleagues to support an amendment that establishes a clear understanding of the value of biomedical research, of both, again, that opportunity to increase the longevity of our lives, to improve the quality of our lives, to combat those diseases that are so devastating to so many families in our country. Knowing that when we do that, not only are we improving individual lives, the well-being of families across our nation, but we are also investing in an opportunity to reduce the long-term costs of health care in the United States. Now, Madam President, this issue is one of great importance to me, and I can't imagine there's a senator in our chamber who hasn't experienced the challenges of disease and death in their own families. And we've seen tremendous strides in turning this around. And it is so clear to me that we need to make certain that those strides continue. And I was pleased to have the gentleman, the senator from Illinois, seek me out on the Senate floor this evening to suggest that there's an opportunity for us to work together. And so while I have an amendment filed, Senator Durbin and I are having a conversation tonight, tomorrow, to see if there is a way that we can come together in a joint amendment to fully establish that all of us are in favor of funding the NIH, the National Institute of Health, at a magnitude, at a level that will again restore us at the forefront of medical research around the globe. We'll send the message to our students and future scientists that America is the place that medical research should occur and where they should pursue their careers, and that disease can be conquered, and that lives can be restored, and most importantly, that hope can be had in the United States, that the serious and debilitating diseases, the causes of death that so many families face day after day, year after year, can be cured and treated. So, Madam President, I look forward to those conversations with my colleagues to see that we find the right words to bring us together to demonstrate significant and real support for funding the National Institute of Health. And I yield my time.